over. Okay. Okay, Liz, what we're gonna do today is I'm just going to listen to your lungs, make sure they sound clear, and I am also going to have you perform a 6-minute walk test. I'll kind of explain, what that is once we perform that here in a little bit, but what I want to do right now is listen to your lungs and make sure that I'm hearing everything okay. Is that okay? Okay, so I see you already have your shirt off. Thank you for doing that. It just allows us to hear your lungs better. And what I'm going to do first is I'm going to listen to your lower lobes of your lungs, so the lower part of those lungs, and I'm going to listen to the upper part of your lower lungs, if that kind of makes sense. But if you could just turn around for me and sit on your chair sideways. Good. And what we're going to do here is just going to make sure we get this on camera. So what I'm going to have you do, like I said, I'm going to put the stethoscope on your back and put this on your back and listen. I want you to take some deep breaths when I ask you to, and just try not to talk just because I need to listen. But if you feel fainter at all and you need a break, we can definitely do that. So, okay? Okay, so first what I'm going to do is just going to palpate here. So this is C7, T1, T2, T3, T4, T5. I'm just trying to count out where I'm supposed to go here on your vertebrae. It's at T1 in the medial side of your scap here. And do you mind if I move this sports bra?
Sure.
Okay. Listen right here. And the stethoscope may be cold. Okay, take a deep breath for me. Another one. Good, another one. Excellent. Those sound great. We're just going to listen to the other side here. I'm just going to move this away here. Okay, same thing. Good. Another one. Good. Okay, now you can turn around. I do want to listen to one more, but before I listen to the other one, I just want to let you know that your lungs sound great from behind there. I don't hear any wheezing, I don't hear any crackling. What I'm supposed to hear when I listen to those part of your lungs is what we call a vesicular sound. And basically all it means is that, it's going to be a little, it's going to be, pretty soft. And it's going to be like sounding a little bit breezy. But what I'm basically listening for is your inhale, so when you breathe in, and then part of your exhale when you breathe out. That's exactly what I heard. So we should be all good there. Now what I'm going to listen to is your middle lobe, specifically the right middle lobe, so on this side. And what I am going to be, actually, we're going to compare. It says right middle lobe, but we're going to compare both sides. So basically what I need is for you to come a little bit closer so you can be in here. Good. And we're going to kind of go on this side, just like this. And it is going to be in your 4th to 5th intercostal space, midclavicular line. So here's 1, 2, 3, 4, 5, right here. Do you mind holding this for me? Yeah, cool. Perfect, same thing. I'm just gonna listen. Good, and I can hold it now. Hold on. Okay, go ahead and take a deep breath. Take another one. Good, excellent. Now I'm gonna do the same thing on that side, on the other side. So if you can go ahead and find that's relatively that same place there. Good, I'm just gonna count down. 5. Okay, where's my other hand? Okay, I can get it. Go and hold. Okay, relax and take a deep breath. Excellent. Same thing on that side. Everything sounds great. No wheezing, no crackling. You know, on that side, I'm supposed to hear, you know, the full inspiration, and then no gap when you expire, when you breathe out. So breathing in, breathing out, no pause in between. That's exactly what I heard. Okay, any questions? Cool. We are going to do the 6-minute walk test. And, you know, like I said before, we are going to, I will be basically counting how many meters you can walk during the 6 minutes. But before we get into that, I just want to take your vitals. So, you know, I took your heart rate, your respiratory rate, your pulse ox, your blood pressure, and all those. And it looks like right here, so I'll explain these to you. Your blood pressure was 119/78, just sitting here, which is fantastic. Usually we look for 120 to over 80, and yours is right around there, which is great. It's actually a little below that, so that's great. Your pulse ox looks like it's 98%, and normal range goes from 95% to 100%, and yours is 98, so it's great. Your heart rate is 80 beats per minute. You know, usually we look for in between 60 to 100 beats per minute. Yours is right there in the middle. And then your respiratory rate is 21. And usually we look for around 16 to 20 beats per minute. Yours is just one above. Just tells me that you're breathing a little fast. Now, before we get into this test, I want to teach you what we call the RPE scale. And what it stands for is rate of perceived exertion. And basically, it's a scale that we use here in PT to allow us to understand how hard you think you're working. And so it's a scale from 1 to 10. 1 meaning, you know, you're not working at all, very hard. And 10 meaning you've never worked this hard in your life, you're exhausted. Does that make sense? So if you were sitting here right now, you know, we already talked about this before, but it says you're at a 2 RPE. Is that, you know, correct?
Yeah.
Cool. Okay, so what we're gonna do is, like I said, I'm gonna get up. I'm gonna be taking your vitals, you know, just how I took them here and sitting. I'm gonna be taking your vitals throughout the entire test, and then we'll come back and I'll go over those results with you. I do wanna let you know here before, and I'll allow you to put your shirt back on, is that, you know, if you feel, you know, too short of breath, if you feel any chest pain, if you have any, you know, if you just have the inclining to just stop the test for whatever reason, that is your choice and we can stop it. And just let me know about those things too. Just communicate with me. Okay?
Okay.
Okay. So you go ahead and put your shirt back on. That was Mike, sorry. Yep. Then I'll go for a walk with you.
Ready.
Okay. So let's go this way. Nice job. Ray, let's go back this way.
Wow,
Good.
that was a long
That was
6
6 minutes.
That was a long 6 minutes.
Good job. Okay, Liz. So I wrote down everything during that during that 6 minutes. And all of your values look great. The only thing I want to talk to you about is that, you know, during that 6 minutes, you were able to walk 450 meters. However, for a person who is your age, they should be able to walk 736 meters. So what does that tell me? Your values were great, your vital signs, you know, but you weren't able to walk as far as, you know, maybe the norm is for your age. So it just tells me that there's something to work on, you know, so maybe we can work on your aerobic capacity here a little bit here in PT, and do some fun things and get you back up to your age-related norms. How does that sound?
Okay.
Do you have any questions for me as before we go?
What were my vitals?
Your vital signs?
Yeah.
Yeah. So, like I said, I took them all throughout the entire test. You know, your O2 saturation, your oxygen saturation, it tells us how much blood you have in your, how much oxygen you have in your blood. That relatively stayed the same, which is 98%. Your blood pressure and your heart rate did go up a little bit, and that's exactly what we want, because when we're doing exercise, we want those values to increase. And you know, what we look for is if they decrease, because that's not too good, because your body needs to, or your heart needs to be pumping more blood, you know, as you're working harder. So we don't want it to not, you know, we don't want it to decrease. But we also are looking for to make sure that it doesn't go too high. And at your peak, you were at 145 heart rate, and you know, your blood pressure here at the end was 140/78, which, you know, is pretty good to me. And we got you up to a 6 RPE, which tells me that you were working pretty hard. And it also tells me that we can always just improve. There's areas to improve.
Cool.
Does that sound good?
Sounds great.
No questions?
No, ma'am.
All right. Well, perfect. Thank you.
Mm-hmm.